Okay, Ashley, thank you very much. So first of all, thanks to Ashley and the NPA for coordinating the webinar this evening. Thanks to all of you for taking time out of your evening to join us to learn more about HasHealth, and also, I suppose, more not alone about the application, but also about how you can digitalize clinical services. So my name is Olin O'Sullivan. I'm the head of growth and the business unit lead at HasHealth. I'll give you a bit more background on the company and where we've come from in a sec. But I'm also joined here by Pedro Andrade, who's one of our customer success managers. He's an expert in the product, so he'll go through the product for you this evening, and will also help answer any of your questions with examples within the product where possible. So as Ashley just outlined, if you have any questions, pop them into the Q&A, and then we'll hopefully deal with them one by one as we go through that process. So we hope to have a reasonable amount of time for Q&A. All right, great. So I'm just going to share my screen, and I'm just going to quickly go through some slides. And then once we do that, Pedro will jump into the application. So whoever, Pedro, can you can see everything? Okay, great.
Yeah,
so hopefully everyone can see that. So basically, HasHealth is it's an appointment booking software that can empower community pharmacists and pharmacies to optimize the delivery of clinical services, both in clinic and remotely. And remotely means with video. So it's something that is really a really interesting part of our software, is that you can integrate video calls within the application, and you can consider what service types you can use that with. So we have examples of using it with NMS and also with travel health clinics, and we also feel that there's a variety of opportunities within independent prescribing as well. Okay, so first and foremost, booking, and then also lots of other opportunity with things like video. Okay, so where do we come from? So you probably hear from my accent that I have an Irish accent. So we're an Irish company, and our mission is to inspire everyone to expect more from healthcare. So we're all about delivering better patient experiences, and in our view, that's about freeing up time for clinicians to focus on at the top of their license, so that they can deliver great patient care. So we're part of a company called MediHive, which is one of Europe's leading telehealth providers. So we manage both clinical services and software in some markets, where we actually manage doctors to deliver video consultations. We interface with pharmacies, but then we also work in a number of diverse areas just with our software as well, including we work with one of the largest CPAP device manufacturers in the world, and HasHealth is very much a community pharmacist focused tool, which is a software as a service solution. So it's a tool that comes off the shelf, so you can start using it. It's browser based, very easy to get set up and utilize as well. So why was HasHealth created? I guess if you think about some of the challenges that you face, and what we hear from our customers is that really time is very constrained. So I think in most businesses, it's very much an undervalued resource, and I think in community pharmacy, it's possibly more undervalued than anywhere, given the fact that you're running busy retail businesses, but you also offer a very important service to the community in terms of the clinical output that you provide. And what we've seen is that there's demand pressures across the healthcare sector. These were amplified by COVID-19, and then that has a big impact on the amount of time that staff need to dedicate, and it can be then morale can be drained by not alone the additional workload, but also because it's of the nature of a clinical businesses and the requirements for regulations and procedures, that there's often a lot of what is deemed unnecessary admin. And with all of that going on, it's also hard to take on change. So clinical service is an area that clearly the NHS want to grow. There's a lot of opportunity in it, huge potential to alleviate some of the bottlenecks in the healthcare sector with the skills that pharmacists possess, and particularly, globally, there's a global doctor shortage, but that requires change. And when you're very busy, and you've got lots of things coming at you, that's quite hard. So that's what we try to focus on. We feel that we can get some of that time back for you. So on some of the tests that we've done in a busy flu season, for instance, we feel we can get 20 hours of your week back. So really, what at the core of what we allow you to do is we allow you to capture bookings, get bookings, manage availability, and then also capture clinical data as well. So you're not constantly having to request that from the patient. Excuse me. When they're coming into your store, so you can pre-capture some of that information. So how we do that in terms of getting bookings, we easily integrate branded booking widgets. So when we say branded, that means branded in your colors, relative to your brand on your own website. So it's not sending your customers off to a different website where they're learning about us instead of about you. You don't need any technical knowledge to do this. And you've full control then of the service and the availability. So once you drop in one line of code on your website, you've got the control of the calendars and the widgets. And thereafter, you just update your own availability or your staff's availability, and that's dynamically updated to your website, but also in store. So you're working off one single calendar. Okay. And then managing availability. This is a crucial point we feel is very important. So it's great to have online bookings and you can drive up a lot of demand, but if what leads to a poor patient and also staff experience is when that can't actually be facilitated. Things like double bookings happen. You're not sure if you have the requisite staff available. So we give you the ability to set staff availability. You can have one calendar against multiple services. So let's say you're running ear cleansing and a travel vaccine service. Both of those can be available, so you can capture the business, but whoever gets the first booking, so if someone comes in for an ear cleansing service, you're no longer available for the travel vaccine service. Okay. And we can limit by things like stock as well. So you can set up all the appointments, you set up your availability, but you're only getting a certain delivery of vaccines. You put in a limit on that, and then that allows you to continue to not have to continue to update the availability relative to stock. And then we put a lot of the control back into the patient's hands, so they're not contacting you about updating their booking. They can cancel and rebook themselves. And we can also capture registrations before allocating appointments. So say in flu in the summertime, you want to start marketing the service. You've got like notices in store about it. You've got it on your website, but you don't have your staffing calendar set up, and you're not sure what vaccines you're going to get. So you capture the details from the patients. When you're ready to allocate the appointments, you can do them with the system. So the system can automatically allocate them for you. So then that takes away a lot of that, heavy lifting that often gets done when you're already delivering the vaccinations and you're unsure whether you're going to fulfill the appointments relative to the stock you've ordered. Okay. So capturing data, so we've pre-screened data, so we have forms that we put in that we can against each service. So for NMS or for flu or for any particular private service, and you can capture data. You can capture patient data with those forms. Each appointment comes with a patient record, and you can communicate directly within the patient record with the patient. You can communicate via SMS, you can reschedule appointments, you can add clinical notes, and you can review the questionnaire details as well. So ultimately and at this point I'll be handing over to Pedro, but what we want to do and what we hope we do for you is maximize revenue from both NHS and private services. So What we think about with things like flu, it's a high volume service. You're increasing the appointments per store and administering more vaccines per hour. For something like NMS, it's like, well, okay, it's 3 appointment service. How do you make sure that you minimize the amount of checking and follow up with patients to make sure you can schedule the 3 appointments? So we look to link the appointments all together. Within the patient record, you can leave a note, and you automatically reschedule the next appointment. You've got a nice consistent record of the 3 appointments, and you could potentially deliver them with video as well. With private services, it's a way to easily test them. Sometimes they don't always work, but you can easily launch and you can use different tools to maximize them as well. Okay, so I'm going to stop talking for now, and I'm going to stop. I'm going to stop my screen share, and Pedro is going to take over, and he's just going to show you how we facilitate some of the things that I've outlined with the software.
So hello everyone, my name is Pedro. Thank you for joining today. I hope you can see my screen right now. Can you see Olan, everyone?
Yes.
Okay, that's great. So again, thank you for joining. I think based on what Olan just said, I think one of the goals for HasHealth just to make your life easier. We know the struggles from the day-to-day that running a pharmacy can cause. What we will do today, it's a very quick, like 5-10 minutes demo. What we will show some of the features that we have and how you use that. And of course, the most important, how easy this can be done from your point of view. We always say that when you first log into HasHealth, that's the dashboard that will get you. So that will basically tell you what are the number of appointments that you have on that day, the number of waiting list registrations that you had that day, that we will talk a little bit further later, and the number of orders received. But I think the most important thing that everyone needs to be aware that this is a 4-step. That's 4-step pathway that we need to go through to make sure that you are delivering the best to your customers. The first step that we always say, we can see here in the left menu are the services. So it means what you will offer to your patients in related to services. Like well said by Olan, those can be private services like travel health that can be done through in person, that they are actually going to your pharmacy, or that can be done to a travel health. That's a video appointment where actually the pharmacist will see the patient online. That can also be on a waiting list mode. And Pedro, what means a waiting list? You can start capturing data from flu vaccines earlier in the year, around May, June. And when you start your flu season, it means that you will have like a pre-populated waiting list already done, so you can have a good idea about the stock that you need. And the third option, it's a click and collect. That's an order model, where actually will be those services that requires your pharmacist to review and say if that patient it's suitable or not for that. I won't go deeper here, just to show what you can see for each of those ones. I will quickly show some of the things that Olan outlined that I think that's very important to show here. One of the biggest time savers that we can say, and one of the struggles are regarding phone calls when you have some appointments scheduled. All those services, they will give you the option to offer a cancellation and rescheduling to the patient. So you will set up the number of hours before the appointment that an appointment can be rescheduled, can be canceled. So it means that the patient won't need to call the pharmacy if they have an errand and they need to reschedule by themselves. If they have that option available for them, they will basically go through their email and check the next appointment available based on your availability, and they will book without the need to be calling the pharmacy. This will include a part of that, all the description that Olan outlined, the limit of appointments that can be done. Pedro, I'm open every day, 8 to 7 or 8 to 6, but I can limit, I only have like 50 vaccines available. So you can limit that. Once the patients booked those 50 slots, the service will no longer be able to be bookable by patients. That will also include the time that you need someone to book an appointment before they go to the pharmacy. So let's say, oh, we have like preparation that is needed. We need to clean the consultation room or do something like this. You can set up based on your availability that patients will be only able to book an appointment 1 hour after the time of when they are booking. That will include as well, I think one of the parts that Olan mentioned, the time saver, it's to collecting the information before the appointment starts. So we have here a preview about NHS blood pressure. There are basically some of the questions asked by NHS when you are getting like a blood pressure measuring service that you need to get from the patient before they actually go to the pharmacy. If they have a diagnosis, if they have any blocker or not, you can get the cohort, the recognized family story, and these will be a range of forms offered for you for all those different treatments that we have. The first step that we are talking here, you can see we have company and clinic. That means if you run a single pharmacy, okay, you have one service to be offered for that pharmacy. If you have 2 or more pharmacies that you manage, you can actually create the same service and spread that across to the remaining pharmacies. That will help you and the pharmacy to keep a standard to make the work easier. That's basically the first step. What do you offer? How do you offer that? The second one, Pedro, how do I make those appointments available to the patients? So every time that you go to staff, we can see that this is a testing example here. We have 3 clinicians, that would be 3 consultation rooms. For each of those ones, if you go to the availability, it means that you can set your own availability for all those services that we have created in the first step. That can be different, that can be the same, but basically give you an idea to say, okay, travel health, it's a very specific service. I can only run those every Wednesday, 10 to 2. It means that once you add those here, that will pre-populate your calendar for all the coming Wednesdays from 10 to 2. You can do the same. Okay, NMS, we work NMS every single day, 8 to 9 or 8 to 6. You can run specific clinics if you wish. So let's say, oh, we will run a specific clinic on Saturday from 9 to 12. You can add here, and that will create a specific clinic. At any time, you can go here and clean your availability. It means that this, if we see here, we can see that that clinician, that consultation room, it's available for all the services, but once a service is booked in, like NHS blood pressure, that slot will automatically disappear from any other service because the platform understands you as a resource, and that resource will be busy at half 8, so they won't be able to allocate or to let any patient to book another appointment. That's kind of the second step. We have gone the first one, that's what you offer. The second one, it's how you offer to the patients. That's much more regarding your availability. The third one, it's, okay, Pedro, like, where do I see that on my day-to-day? What should my pharmacist look at every morning or by the end of the previous day to see what they have available for next day? If they go to the appointments menu, they can see that on a calendar view. We can see here a range of like different colors. That means that each of those different colors, they are different services that you have booked in. So you can check by service, you can check by clinician, you can check for each of those appointments, what is that related to. So we can see for this one, we have a booking done for the travel health video appointment that will actually give you the link to join that. If you want to check today, okay, we have another appointment that's NHS for NMS. I think when we've mentioned that you can collect information before the appointment starts, everything that is set here, you click view, and then you just confirm. In this case, please confirm the date that you started your medication. Like NMS, it's they should book like the first consultation from 7 to 14 days usually after they started the medication. You can actually add a blocker to make sure that people that started today, they won't be able to book an appointment for tomorrow, because basically tomorrow, like they will take the medicine, like they won't have any results. They need to wait for 7 days. In this case, when they are booking and they input the date of today that they started, the system will tell them, look, you need to book from 7 to 14 days in advance, get back and book an appointment later. I think for all those day-to-day management, you can see that you can see by day, by week, by month, that will give you a clear view. And I think it's important. We got I got a question that I saw right before. To create free appointments, you can also get the walk-ins. So someone is in the pharmacy, you can click to add a free appointment. You will select what is the service type, what is the time. You will get messages from the platform saying that this is not times that you are scheduled or that you have another booking, and that will also give you the ability to add the patient details here. On a day-to-day, we are in the third step. You set your services, you added your availability for those services. The third one, it's how you manage that on the day-to-day. One quick example that we will say about a waiting list here that we want to show, that's all those patients. So we have here, 1, 2, 3, 4, 5, 6 patients that are waiting to get an appointment. So at this time, they just showed that they have interest in the service. You can easily go here, click, see all the details, add a note if you need to. What I can see here, there's no yellow spots. So it means that there's no availability for that service yet. So let's say at this time, you did not receive any flu vaccinations. But once you decide that you can select that service and you can get bookings. So let's say we will run a clinic this Saturday from 9 to 12 for that specific flu vaccination clinic. Once you go to the waiting list and you select the patient, you will see that the calendar will show you, okay, you have slots available for the coming Saturday. And that can be done manually, where you just go, select the time. Once you hit save, that waiting list application that was waiting to get an appointment, they got an appointment right now that they can manage, they can reschedule by themselves. Or you can easily do what we call like a book assign. I want to assign for those 3. We just need to select the service here, that's the flu. And then I want to give those first 3 patients an appointment. Once you click assign appointments, that will give them the first in, first out rule on appointments. And once you go back to the appointments menu, you will see that they got all the appointment that they can manage by themselves. And the last one from the day-to-day that we've mentioned about orders, it's basically that kind of service that requires your pharmacist to approve or reprove. You can go here, click that. All those questions that were asked during the patient journey, they are here. So full name, date of birth, all the questions related to treatment. At any time, the pharmacist can actually send a message to the patient if they need to confirm, if they want to ask the patient to come to the pharmacy. If they say that, okay, that patient, it's a suitable patient, I want to prove that. The system will just ask if you want to notify that the prescription it's ready to collection right now, or you can send a link. Once you say, okay, that's ready for collection, I will just prepare that. Once the patient are in the store and they collected that order, you can just mark that order as fulfilled here. It means that when you go back to order, you will see that the only order that you have at this example, that's already fulfilled. So there's nothing that you need to do. You see that have a timestamp here, and anytime that you get a new application and you want to check for the waiting for assessment, you can easily do that through the filter menu. We've mentioned like 4 steps. The 4th step is the latest one. Pedro, how do we get those booking online? So if you have a website, you can easily go to the booking widgets here that will give you like a range of options where you can add that. So let's say I want to create actually a booking page, and I will quickly show you in a few minutes what that will look like on a pharmacy website. You can select, you can customize all the coloring, all the buttons display, if one allowed to display price or not, if that's a private or public service, that will give you the full ability. You can add your terms and conditions, ask for marketing opt-in that will give you the ability to talk with your customers after they had a treatment. The only thing that you need to do is just to copy this code and add this code to your website on a page that you wish. I have a basic example here from that last clinic that we are talking about. That's a very basic booking page from a pharmacy here, where we can see from a patient point of view what will that look like, and that will include, okay, I'm the patient, I want to book NHS blood pressure here. I can select those 4 pharmacies. That's basically the locations. If you have a single pharmacy, that will be direct to the next stage. The system will ask the patient if they already have a diagnosis of hypertension. That's set as a blocker. We won't allow the patient to proceed in this case. So they need to go through to be suitable patients. And once they have done that, they will be given the option to go to the calendar and book based on the times that you set before. I think we set that 8 to 9 every day for a 30 minutes. That can easily be changed by to 20, 15, 10 minutes based on your needs at your pharmacy. Once you have done that, any change that you run on your services, if you create a service, so let's say, oh, I don't want to get any NHS blood pressure anymore, you can easily hide that. Once you are back to your website, and then I'm just going back to the first page. Oops, sorry. You can see that the NHS blood pressure, it's no longer being displayed here, because basically you just took that and you have hidden that service because you no longer want to get applications. So I think on a very quick one, I'm not sure, sorry if I was quick enough, but basically once you have those 4 main steps covered before going live, once you have that service live at your website, you will start to be able to get bookings at that time. Pedro, I don't have a website. I don't want to manage it through a website. I just want to share direct links to my patients. That will also be available here. If you don't have your own website, you can just copy that, share through social media, through email, or any other way that you can contact your patients. And once they have that link, they will be able to book themselves. I think on a overview, that's basically a very, very basic, I would say, Olan, correct if I'm wrong, but I think the idea is just to link what Olan said regarding the time saved from collecting information.
No, that's fantastic, Pedro. As Pedro, as you've outlined, Pedro, there is a lot more in little specific aspects of the application. So
sure,
I do see that we have Q&A that's coming in. I'm just going to go through those now, and we'll see if we can answer them with the application, or we'll answer them directly if that's not relevant. So if anyone does have a question about how do you do, how do you do X with Y, i.e. with the software, just pop them into the Q&A and we'll try to answer them as best we can. So the first question we had, which I think you tried to answer already, but maybe we can see if that did answer the member's question. But Sanjay has asked, in our pharmacy, like every other, we do lots of free consultations, particularly as GP practices are unapproachable. I think, Pedro, you showed a way that you could set up a free appointment. I think, Sanjay, maybe if I've interpreted this correctly, are you saying that you give a lot of free advice as a result of GP practices not being approachable? So that might be something that you're alluding to. If not, just again confirm that in the Q&A. But that's definitely something that we've heard a lot. And what I can say is, by listening to the types of types of requests you're getting consistently, and the types of advice you're giving oftentimes and have been doing for years for free, is there a service in it? is that something that you can actually put scheduled availability around, and you can have consultations around? So like if you think about the medications a lot of time that you dispense, it's around someone's health. So like that's what the blood pressure service is about. But then it's like, well, okay, I've got a blood pressure reading and here's certain advice around that, but can I put people on can I give them advice around how they achieve their objectives? So there are lots of ways to kind of think about how you can monetize your advice and add value at the same time. So hopefully I'm on the right train of thought relative to your question, Sanjay. Okay, so the next question then is, will you be explaining the marketing to all contacts beta? So that one's for you, Pedro.
Oh yeah, that's great. So every time, if we see here, every time that we are creating an application here, so let's say I'm just applying for the waiting list for the flu vaccine. We will go to that book now. That's a waiting list. We want to register for that. That appointment's for me. We will see that we have set the marketing opt-in for that specific patient. So in this case, I will just get Pedro A. Just add my testing here. To my date of birth. I want to join that marketing. Once I hit continue here, let's say that registration is complete. Once we are back to that contact list, we can see that that patient here, it's already available for you. So it means that this patient specifically allowed you to contact them directly. And this can be people that are applying for this year flu vaccination and they are marking that they want to be contacted in the future. It means that next year, when you're getting close to your flu season, you have all your services set up. You can mark all of those patients, click send SMS and drop them. Hi there, our 2023 flu services are available. And then you could paste your URL here. That will basically give you the ability to contact the patient directly through SMS. So any kind of new patient that you get that they mark that option that they want to be contacted, they will be displayed here and you will be able to reach out to them through SMS using the platform. I hope that covered. If not, please feel free to drop me another question.
I just maybe have a follow-on question. So for there are, if I don't elect for marketing, can I still communicate with my patients around with service messages?
Yeah, you can. So basically everyone, once they have applied for a service, so let's say I will get this patient here, patient applied. I'm not touching the marketing, the all contacts that's under the beta here. So this will allow you to contact them directly for operations messages related to that treatment. So everything that's related to that treatment, you will be able to contact them through this SMS. So if we want to touch them using a marketing perspective that's not related to the treatment that they apply at the first time, that needs to be done under all contacts in the marketing one. If you want to contact them directly about a specific treatment, that's basically messages that you need to exchange related to that appointment, that can be done from this appointment menu.
Okay. Brilliant, thank you. So the next question that I have relates to SMS fees. Do fees apply? The answer to that is yes. So we have we have to pay for the fees for the SMSs ourselves as well, unfortunately, and also we have to commit to the development work to manage the fees as well. So it's not like we're a bulk provider of SMSs. We take those bulk providers and then we provide additional services on those, as you've seen. So I think based on like on the pro plan, and it's 9 pence per message, and then on the Pro Plus plan it's 7 pence per message. Okay. The next question asks about, does it take payments at the time of booking?
Yeah, that's perfect. Very nice question. To be honest, we were talking about private service, but we didn't show that. So let's say that I will use Travel Health, like a video appointment where actually they will see a pharmacist for like 30 minutes. If you have a Stripe account connected, what can easily be done through the settings here in the left menu. Once you create your Stripe account and you link that to HasHealth, you will be able to mark this accept payments option. So basically, it means that during that journey that I've just showed you here, by the end of that, based on the price that you set here for that service, the platform will collect the payment online from a credit or debit card. And that means that you will be able to manage all those payments through your Stripe account, and you will be able to manage and get all your payments from that point. So yes, you can collect payments online. You can see that. And in 2 weeks' time, you will be able to refund patients directly from the platform as well.
Pedro, I'm just going to add to that question. The benefits of taking payments online, in your opinion, what are they?
Like drastically reduce no-show rates for private services. So that's something that we really saw in some of the farms that we are partnering with. Anytime that you book a private service that you have already paid for that will definitely reduce no-show rates for that specific service. We saw some examples about like NHS services with a higher cancellation rate because they're not paid, but when that go through private services that are paid online, definitely that will push patients to go and finish that treatment with you.
There is one other way you can take payment, and you mentioned the video call, particularly for higher price services. So sometimes with higher price services, there's a bit of friction before they want to pay for it. So let's say travel vaccines, it's a high cost. Sometimes patients they're a bit slow to kind of make that decision. So some customers have used a video consultation first, go through all the needs that are required, and then take payment within that video call. So maybe you could just go through how you can do that.
Yeah. So if we go through here, let's just try it. I think that was video consultation. Also, let's just create one here. So I'll just create an appointment because I'll just create an appointment right now for a travel health video appointment. That's be 8:15. I'll just add my details here. Oh, sorry. That's my mail. I will add my phone number here. Once I click save, this patient will get a notification straight away about that appointment. Once I click to see that patient now, that will actually bring me, pretending that I'm a pharmacist, maybe we can get some echo here because of the 2 ones. So Pedro is not online right now. I just got through my phone a message saying that I have an appointment right now. Once I connect here as a patient, let's just get this, let's just send that patient details here. That should be in 3 seconds. Once the patient is connected to that appointment, we will see here in the bottom that will appear 3 new options for that one. That will be to collect payments online, to screen share with your patient, and I'm not sure why I'm not receiving that here. I'll just check that, but basically once the patient is connected, that will show the option here. I'm not sure. I'll just restart my phone. I use the old phone here. I'm not sure why the SMS is not landing here.
I hit you with the hard question in
Yeah.
a webinar, Pedro. My apologies.
No, that's okay. No, but definitely that's my phone. So yeah, I just got that here. Bear with me. Ooh, no, that's working. No, just we're just connecting here. So just loading because I'm using my network from both sides. Just showing up here. That's today, 8:15. You can drop a message to that patient, send attached files if needed. I can grant access here through my phone. So yeah, here we are. I'm just showing my top. You will see that you also have Stripe. this option will be marked to take payments online as well. So we can see that you can screen share, take a screenshot, and get payments online.
I think that, like, sorry for putting you through that.
No, that's
but
that's
you could see actually, like, even in a stressed environment, it's actually not that hard to do. And the great thing about that, particularly for private services, you can have video consultations where someone gets a free consultation. So you could market for that service to capture patients, bring people through, and as long as the margin is high enough, then if they're willing to go for the service, you take payment up front, and it could be an in-clinic appointment, and that you then book them in to come to the clinic, but they've already paid. So that's a really good way to consider about your marketing. Okay. I need just on the questions then. Sorry, I've got behind a bit on the questions. So I have the next question is from Anup, and it's, can the data collection be interfaced with pharma outcomes or MYS? So at the moment, the answer is no, but that is something that we are pursuing, not just with pharma outcomes, but also with other providers in the market and directly with NHS systems. So I would say watch this space. And what we can do is you can export all the information. So all the information can be stored within the system and it's exportable. But it is definitely our intention to connect to reimbursement services and a host of other services where possible. That's part of our value proposition that we want to add to you, is save you time. So we don't want you to be to constantly be double entering data. But unfortunately, we can't do it all in one go. But that is definitely part of our roadmap. Okay, so the next question is from Kevin, and it's, does your product allow the user to record and save the required data for the NMS service to avoid the need for paper recording? So Pedro, you might want to address that.
So basically, from I would say from a patient point of view, so all the data that I apply as a patient and once I give the consent, that data will be directly allowed to the pharmacy at that time. So basically, in this case, the patient will only get a notification regarding the appointment and reminders. I think that's the question, if I'm answering correctly.
It relates, I could be wrong here, but I think it relates to the details that need to be stored for the service. So there is notes that can be taken within, so it's 3 appointments. So you can take, there's free text notes that can be saved against the appointment, and they will be linked to the relevant user.
Yeah, so basically in this case, let's say we have just finished that consultation right now. So I can add a note, consultation finished. And then please check blood pressure ons in store. You can add this note here. You'll see who added that note at the time. You can also schedule a new appointment for an in-person. So that's coming from a video and then just said, yep, I can get that patient in my store. You can get that, schedule an appointment. Want to see this patient in a week time at 4 p.m. You see that they have all the details here. Once you save that appointment and you go to the next week here, you will see that there's appointment coming from a travel health, but it's totally linked to another appointment where you can check and see all the notes related to that previous treatment.
Okay. So the next question, hopefully, Kevin, that answers your question. If not, please respond in the chat. From Mohammed, what is the cost and is there a minimum contract? Okay, so there is a minimum contract and it's 12 months. And the cost, we bill annually. So our pro plan is £48 per month, or £576 for the year. But as an NPA member, you get a 15% discount on that plan. And the Pro Plus plan is £60 per month, or £720 for the year. And again, there's a 15% discount on that plan as well. The difference between a Pro and a Pro Plus is that with the Pro plan, you get to, you can basically, if you're a single clinic, that's sufficient. If you have more than one clinic, you may start to find that you want to set up services across clinics. So you want to be able to like set up maybe a flu service across all the clinics in one go, but then you also want to have the flexibility of the clinics to set up their own services. So that's where the Pro Plus plan would be for you. And it's just and then finally, that those costs are per location. So if you're one location, the 576 less 15% is the cost that you will pay for the year, and the only other charges are then for the SMS. But if you're multiple locations, then you will pay the cost by the number of branches that you have. Okay. Next question. Is the payments just via Stripe, or can this also be undertaken via Judo Pay or WorldPay? For the moment, it is just via Stripe. That's the only payment service provider we use currently. So Sanjay has another question. Who owns the patient data? In the past, if you leave a service, they jump on your patient. So they can, I assume you mean that like they try to take your patients. You own the patient data. We are very clear about this. And actually, like, GDPR compliance and HIPAA compliance for us is a key part of our value proposition. We are audited by the likes of AIG. As part of our contract with Roland's, they're owned by the Phoenix Group, which is a German company, and very rigid data protection legislation there. So we're very much about ensuring that you own your patient data. And that we treat it with the utmost confidence. And we want to give you the tools to be able to manage it in that way as well. So that's why we talk through in terms of how you manage marketing versus service messages and how you can discern between the two. Okay. Next question. Yeah, what is the cost of your service? You mentioned Pro and Pro Plus. So yeah, so I think I just outlined that a second ago. So if that is still unclear, so for Pro, it's £48 per month, or £576 annually. As an MPA member, you get a 15% discount. For Pro Plus, it's £60 or £720 annually. Again, 15% discount as an NPA member. In addition to that, if you are a multi-branch group, then it's per location. If you're single, you just have to manage the one branch, obviously. Okay. I think that covers most of the questions that we have. All seem to be yeah, that's we've got no further questions. Is there any other questions that that people have? Please enter them. Is there a help number if we encounter difficulties? So we do have numbers that we will call you on, but the way we run our support is, first of all, via email. So we log the tickets, and then our support representatives will see if they can solve that very quickly, and if not, they will call you. So that's how we run our support. But it's part of the final closing slides, but customer success is crucial for us. So Pedro is one of the customer success managers. We will onboard you. We will have our own training webinars. So if you want to have time for your staff, we can either record them or do them for the group together. So we make sure, if you're not using the software successfully and increasing your services revenue, you're not going to stick around with us as a customer. It's not a once-off sale for us. This is we want this to be a multi-year relationship, and we both add value together. So we're here to help you succeed. Next question. Which private services are proving to be the most successful for bookings? Pedro, I guess that's a hard one, right? Like, it depends on the company, right?
Yeah, so we get like travel services, weight management services. We get private flu vaccines. I think everything will come from the focus that you want to give for those services. I think it's very important that you have clear on your mind what you want to offer and what is the message that you want to give to your patient. And so you bring them to the first time using HasHealth, that will make your pathway way easier for them to come for new different services. I think the example that I shared regarding create a second appointment from a previous one, that can go like customers can go to your pharmacy, get maybe a flu vaccine, and then you can talk about new services. Can you schedule directly from the platform? So I would definitely say, like, there's not a specific one. It's basically the effort and the focus that I want to give for those
Yeah,
services.
I think from what I've heard, I've got two, like, so one being travel clinics and the other ear cleansing are coming up a lot outside of the NHS services. I think like anything where there's good margin, that's where you want to think about how, like, instead of volume. I know in a lot of NHS services, it's a lot about volume, but thinking about value and how you can use tools to capture patients to then nurture them through to actually deliver the service. So there's, yeah, like, and then that's how you can specialize and differentiate. Traditionally, maybe in community pharmacy, everyone tried to copy each other. So, but really with private services, you can create specialisms. And I think that creates a lot of opportunity for smaller community pharmacies, particularly. Okay, so another question that we have is, how long have you been doing this and what have been the results so far? So we've been doing this with HasHealth. It's running for the last 2.5 to 3 years now, Pedro, right?
Yep.
So initially started in the pandemic. It was a subset of our core video solution, which was running with a private telehealth business and managing a national population of patients. And GPs needed video at that time, so that's why it was launched. And then we actually launched in the Irish market, we actually pharmacies managed COVID bookings as a private service. So we launched that, and that created huge. We had to manage huge patient volumes in a very short space of time. So I think it was about 300,000 we took in about a space of a week. And that's where the waiting list came from. So because there was so many changing guidelines, and so that was a huge advantage to us. It didn't feel like it at the time, but it was fantastic because the product developed a lot in a short space of time. And then we've been working in the UK market for the last 12 to 15 months. We work at Rowlands and a host of independents. We've been approved by the NPA. We're finding out more and more how we can leverage some of the GP tools that we had, but specific to community pharmacy. And we see a lot of opportunity in the likes of independent prescribing over time as well. So yeah, like I think it's we've seen some really good results. And the main thing what we've been able to achieve is save a lot of time for pharmacists. Okay, so other questions. Do you have a platform to browse around and get a feel for it, and what facilities the platform has? The platform is web-based, so but we don't offer a free trial. And the reason we don't offer a free trial is that we feel that the success metric is when you commit to it. And then we set you up relative to the services that you want to offer. And for us, it's about setting an objective. So if you have a suite of services that you feel that you want to be successful with, you come to us with an objective and we'll work with you to achieve that. And we'll train you how to use the software. We feel that you need our help and we're here to support you. So that's what we do. So we can give you another demo of the software where it's one-to-one, but ultimately then you have to make a decision. And then once you make that decision, you'll have a call with Pedro or maybe one of his team, and they'll work with you to achieve your objectives. Okay. So another question, can appointments show up on my work calendar, e.g. Google Calendar? Pedro, that's a great question for you.
Yeah, so basically all your calendar, your appointments will be brought here to your appointments menu. When we look to the patients, yes, the patients will be able to bring that to an Outlook and a Google Calendar. But from your point of view, you will be managing. Pedro, why do you do that? So basically, we want to make sure that you not only have the appointments available, but you have all the information and the features that are linked to those appointments. So this is why we have the calendar set here in the HasHealth dashboard. I think you could, yeah, basically it's the idea to bring it to another tool that will only give you a look regarding times, but definitely won't give you all the ability to cancel, reschedule, create new appointments and add notes.
Brilliant. So I think that just conscious of time, so in terms of questions, that probably covers it. What I'm going to do is I'm just going to quickly share my screen.
Just stop sharing here.
And I'll just finish off with a couple of slides just to recap some of the things that we discussed. So when we talked about the waiting list and we talked about flu, some of you might be thinking, okay, well, pre-registered patients, how many of them turn into appointments? We see that 80 to 90% convert to appointments. So if you think about it, if you were able to get like 70 to 80% of your annual target ahead of the start of the flu season or any other, season, that seasonal service, that's a great result. It just takes a lot of that effort away from you. We talked about marketing consents. We see that basically for every booking you receive, at least 15 to 20% of people will accept marketing consents. So that just means the more you're building up your lists and your marketing, the more the bigger your customer base. And you can, particularly with video, you can think outside of your general catchment area as well. Okay. So we really want to partner for success. So as I outlined, you'll meet Pedro or one of his team, and we'll set an objective. We'll onboard and train you to the point where you're accepting bookings and you're making sure that you're generating those savings and ultimately boosting revenue. That's what it's all about. So we really pride ourselves on delivering customer success, and we listen, consult, and most importantly, we reflect your feedback in our product. So this is not like a static product. We listen to you, and by listening to you, we're listening to your competitors and other people in the market, and we're gathering all that feedback, and that goes back into the product. Okay, so that's really important in terms of the value from software as a service. So listen, I'm delighted that everyone listened to us for so long, and thank you very much for your time this evening. It was a pleasure. If you do have any specific questions, you can reach out to me on the contact details below. I believe this will be shared anyway to the distribution list. And I encourage you to also follow our LinkedIn page. We leave some really good digital tips there on a daily basis. But thank you again for your time this evening.